Good afternoon, everybody. I have a lot to go through today. And I'm going to begin, as I always do, by thanking you for tuning in to the 1 o'clock. We'll continue to do these every day at 1 o'clock, and I hope at the end of this you have a sigh of relief, having some sense of confidence that we have a robust, comprehensive, statewide response to coronavirus, and that everything we share with you is rooted in the facts and relates to Rhode Island, despite what you might be hearing about other places around the country. A quick note about Sunday. Sunday is, of course, Easter Sunday, a very important holiday to many of us here in Rhode Island. On account of the fact that it's a holiday, and I know members of the press could use a day off, as could many folks who work for me on my team. Sunday, we will not have the 1 o'clock press conference live. I will be doing a video announcement, and I'll make sure to include any important information in that video. And happy Easter to all. Today, I'm very sad to report another 6 deaths as a result of coronavirus, bringing us to a total of 49 deaths in the state of Rhode Island. We have 288 new cases in Rhode Island for a total of 2,015 cases, and we have 169 people in the hospital. Today, I want to spend some time talking about unemployment insurance. I want to begin by acknowledging that we have tens of thousands of people in Rhode Island right now who are unemployed. The amount of economic sadness and hardship is mind-boggling. It's like nothing we've ever lived through before. And I just want everybody out there who's hearing me, who's unemployed or laid off or their hours have been cut back, I want you to know I'm working hard every minute of every day to do everything I know how to do to get you back to work as soon as possible. And in the meantime, we're going to do everything we can to get an unemployment insurance check or benefit into your hands. There's a lot of changes as it relates to unemployment insurance. The federal government has made many changes, and so bear with me, please, for the next few minutes. I want to give you a comprehensive rundown to the best of my abilities of exactly how unemployment insurance and coronavirus pandemic insurance is playing out right now in the state of Rhode Island. I first want to mention that we are totally overwhelmed. We are up to 132,000 claims. That we've never seen anything like that. 132,000 claims have been filed for unemployment insurance in Rhode Island over the past few weeks. Some days we are receiving 10,000, 12,000, 14,000 claims in a day. I will be the first to acknowledge that our system is not perfect, and you are going to have to wait longer than you want to wait or should have to wait to get your check. Every day, literally every day, we're getting faster and better and more accurate. And in the meantime, I'm going to ask for just a bit of patience as we work the kinks out. Currently, it still takes between 1 and 2 weeks to process claims. I know there's been some confusion, and frankly it is confusing, exactly who's eligible, who's not eligible, and how do the new benefits compare to the traditional unemployment insurance benefits. So I'm going to give it a go here to try to clarify any confusion, and then I'm happy to answer any questions. So first, I want to remind everybody that as of right now, on account of new federal stimulus, federal law guarantees 10 paid sick days for every employee. So this means anyone who's quarantined for 2 weeks is able to stay home and is guaranteed that they will continue to receive a paycheck. Everybody gets 10 days of paid sick leave. And that's in addition to whatever vacation, paid time off, etc., that you otherwise would have had. This is a new federal benefit. It applies if you're sick, if you are ordered into quarantine, or if you are caring for someone who is sick or in quarantine. Now I'll go on to unemployment insurance. As a general rule, you can collect unemployment insurance only if you've been laid off or your hours have been reduced. And that's what I said yesterday. So in order to qualify for unemployment insurance benefits, you have to have been laid off or your hours severely reduced. And that also includes if we have forced your business to close and you've been laid off. You are qualifying for unemployment insurance benefits. In the CARES Act that the federal government just passed, and by the way, thank you again to the hardworking members of Rhode Island's federal delegation, the federal government expanded eligibility for unemployment insurance benefits. They created a new kind of benefit called Pandemic Unemployment Assistance, PUA. This PUA covers 2 additional classes of people who have been laid off, and it is fully funded by the federal government. The first group are self-employed and sole proprietors. So this is hairdressers, independent contractors, gig economy workers, self-employed people. You guys are now eligible for unemployment insurance type benefits, fully paid for by the federal government, and they are technically called Pandemic Unemployment Assistance Benefits. I would like to note that Rhode Island was, as far as I know, the first state in the country to start getting the PUA benefits out the door. Great kudos to Scott Jensen and the team at DLT. So as of Tuesday of this week, we were open for business, getting out the door checks for folks who've been unemployed due to coronavirus who previously were not eligible. Now then there's a second group of folks who are eligible for the pandemic unemployment assistance. And this is where it gets tricky, because these are people who maybe haven't actually been laid off, but are, for the purposes of the crisis, eligible for the PUA. These are people who've been told by a doctor to self-quarantine because you're at high risk, or where you are the only person available to care for a child or a loved one who cannot stay home alone because the place they receive care is closed due to COVID-19. Now, I want to be crystal clear about this. This category is going to take the longest for us to get the checks out the door. This is a whole new kind of benefit. So this is for people who you haven't lost your job or been laid off, but you have been affected by coronavirus in a way that the federal government says you're allowed to receive a benefit. You are going to have to go through a great deal of scrutiny to prove to us that you fit the criteria. For example, that your doctor has said it's not safe for you to work. Soon, by Monday, the Department of Labor and Training is going to have regulations around how that kind of benefit will act more specifically, so you'll be able to go online and see whether you qualify. But I want to be very clear. If your business is currently open, that's because it's an essential business. And if you're able to go to work, we need you to go to work. So please do not quit your job because you think it's going to be easy to get unemployment insurance benefits, because it isn't. And in that category of people where you still have a job, your employer is still open, there will be strict scrutiny applied to make sure that you actually qualify for this new pandemic unemployment assistance benefit, and it could take a month or more for you to actually receive a check, because we are going to have to go through case by case to make sure that you are in fact eligible. So, 3 kinds of benefits. First of all, everyone has 10 days of sick leave. Second of all, if you are unemployed because you've been laid off, you're almost certainly eligible for unemployment insurance. If you've been laid off, if I've closed your business, if the business is shut down, you're unemployed, your hours have been cut, you are eligible for an unemployment insurance type benefit, even if you're a gig worker, hairdresser, etc. Go to DLT's website and file an application. We'll do our very best to get the money in your hands within a week or 2, recognizing we're overwhelmed. If you haven't been laid off, but if you think you fit into that very narrow category of folks who've been affected by coronavirus to the point that the doctor says you can't go to work, then you are eligible for a PUA benefit, but it's a long process. I'm warning you, if you try to quit your job because you can get this unemployment insurance benefit, you will be denied, and if you slip through and we later find out that you tried something that you shouldn't have, that is fraud, and there will be punishments. It's brutal to work right now. I understand that. Nobody wants to go to work. It's scary. I understand. For some of you who work with the public in grocery stores, in home health care, I totally get it, that it's a scary time to go to work. But the truth is, those of us who can work have to work. And if you're in a business right now that is still open, healthcare worker, grocery store, manufacturing, those of us in state government, those on the front lines, first responders, if you're able to, if you're healthy, we need you to do it. We need you to continue to go to work because Rhode Island needs that. And if you're an employer who is still employing people, I need you to do everything you can do to keep your employees safe. You must require them to stay home if they're sick even a little bit. You must provide them an opportunity to wash their hands and have hand sanitizer. You must provide them an opportunity to have an appropriate social distancing. So it's on the employers to make sure that conditions are safe. And it's on us too, me too, to continue to do a better job to get the appropriate PPE out to healthcare workers so that you can do your job and you can do it safely. I will say, I want to make another point about unemployment insurance payments, which is in the vein of good news. For those of you who are receiving unemployment insurance, thanks to the hard work of our federal delegation, your weekly payment starting next week is going to go up by $600 a week. So everybody that's receiving a weekly payment will start to see an extra $600 starting next week. It will be automatically deposited in your account, $600. That's if you're part-time or you're full-time. Now, understand, again, this is an imperfect system and we're doing our best. So it's going to take us about a week to get the $600 loaded into your account from the time that you start getting your check. If it's not exactly a week, hang in there for a few more days. The $600 will get there as soon as we can. For those of you who've been out of work for a while, I understand this can't come fast enough, and it is my hope that it helps you out even a little bit, gives you a little bit of breathing room to help you get through this crisis. I will say that I have also asked our federal delegation and am calling on Congress to provide some kind of similar $600 benefit to low-wage essential workers who are still going to work. I think it's terrific that they've increased the benefit for those of you who are unemployed and lost your jobs, but I also think there should be an increased benefit for the essential workers that have to still go to work to provide incentive to work and, frankly, to compensate for the fact that it's harder than ever now to be working in these essential businesses. And I know that our federal delegation supports that, and they are fighting for that, and it is my hope that sometime soon I'll be able to make an announcement to that effect. Continuing on with unemployment insurance. Yesterday, everything we're doing now is to try to get the money to you faster, in a more streamlined fashion, and to try to simplify what is clearly a complicated process. To that end, yesterday I signed an executive order which I believe will make it even easier for us to get the money into your account more quickly. The order ensures that individual businesses who are closed during the pandemic will not be penalized for their workers accessing unemployment insurance. So for those of you who aren't familiar, unemployment insurance works a little bit like car insurance. You get into a car accident, your insurance premiums go up. Same thing is true essentially for unemployment insurance. If you're an employer and your employees use unemployment insurance a lot, your premiums go up, in effect. Your unemployment insurance tax goes up. I'm saying that is not the case in this pandemic. I fully recognize that I'm the one who has ordered you to close your business. So therefore, I don't think it's fair to then punish you with higher UI taxes on account of the fact that all of your employees are now filing for UI. So per this executive order, I know you're laying off a lot of your employees. You will not see any immediate increase in your UI taxes on account of the fact that there's higher usage by your employees. And this is a dramatic step, but I think it's necessary. This is an unprecedented situation, and I know that almost all of you would rather be open right now, but you can't, and you're doing your part in the crisis, and I don't think you should be punished on top of that. The executive order I signed also allows for data sharing between our agencies, specifically data sharing between Department of Labor and Training and Department of Revenue. So rather than seeking individual tax records on a case-by-case basis, which is what DLT typically has to do, I have enabled it such that DLT will have access to the records of every person that has applied, which will speed up their ability to process claims. That, I hope, will really help us to process more quickly. So instead of DLT on a one-by-one basis, checking with the Department of Revenue to verify income, they'll have broad and constant access to those files, which will substantially increase the rate at which we can fill the claims. Finally, the executive order also allows for recent DLT retirees to rejoin state service and help process claims without having to sacrifice their pensions. It typically takes us a month, sometimes more than a month, to train new staff, and we don't have a month to train new staff. I have to get you your checks today, tomorrow, as soon as I can. So we have gone ahead and we're bringing back recently retired folks from DLT who know how to work the system, who are already pre-trained. We're putting them back to work. Thank you all who are going to go ahead and do this, and we're making it so that you can rejoin the ranks but not take a hit to your pensions. And I want to thank you for stepping up in our time of need. So that's a lot of information. Bottom line is, if you're out of work, you can collect unemployment in one way or another, and starting about next week, there'll be $600 more in your check. Couple other things. I mentioned yesterday or the day before that we have seen an increase in the number of 911 calls on account of domestic violence. And that, although that saddens me, it is not a surprise. We are all out of our routine. We're canceling parties, we're canceling happy occasions, we're canceling holidays. Lots of people are out of work, we're cooped up in our houses, and it is a time of great anxiety and tension for everybody. I would say this. I will again ask everybody for patience and kindness as we get through this crisis together. But I also want you to know, if you're hearing this, and if you are a victim of abuse in your home, you're definitely not alone. There's so many people just like you all over Rhode Island suffering in the same way that you are. So you're not alone, and I want you to reach out for help. Because at the same time, what's happening right now is at the same time we're seeing increases in 911 calls, we're actually seeing decreases to domestic violence hotline, shelter intake, etc., which tells me that people are afraid to reach out or think you might be in it alone, or you're worried that maybe the services that are typically there aren't there for you now. And I want you to hear from me that they are there now. Whatever you normally might do to reach out for help, I want you to continue to do that. And I also want you to know that by next week, I hope to have an even more robust plan to provide people with additional support, services, access to mental health, access to physical health, and shelter, because I unfortunately don't see this problem going away anytime soon. I want to take a second here to remind people some places you can reach out to for help right now. The Rhode Island Coalition Against Domestic Violence and all of its member agencies are open. Domestic violence shelters remain open. They're critical services, and they are ready to take your call 24/7. It's a confidential hotline. Nobody will know you're calling. It's in English and it's in Spanish. The number is 1-800-494-8100. Do not let yourself get isolated if you're being hurt in your house. Reach out and let us help you. And know that there's thousands of people in Rhode Island in the same situation as you. 1-800-494-8100. Also, I have mentioned many times that the courts are closed until May 17th for non-essential business. They are open for TROs and domestic violence matters, which are emergencies and which are essential. So the services are still there, and if anything, we're going to ramp up the services. I would say to Rhode Islanders, again, check in on your neighbors, check in on your friends, check in on your loved ones. If you have a coworker who you know struggles with domestic violence or food insecurity or mental illness or anything, if they are struggling in a normal course of business and now they're laid off, assume they're not having a good time and pick up the phone and call them or shoot them a text, check in on them, and do whatever you can as a good neighbor to give them a hand. Finally, I want to make a mention of RIPTA. I want to begin with a huge thank you to the bus drivers who are out there every day, rain or shine, coronavirus or no coronavirus, helping people get where they need to be. Having said that, we have to keep the drivers safe and everybody who gets on public transportation safe. So as of today, RIPTA will be limiting capacity on all buses to no more than 15 passengers to allow for more space. They'll also be asking all passengers to use cloth face coverings when out in public, which everyone should be doing anyway, by the way, but extra emphasis if you're going to get on a RIPTA bus. RIPTA is available. If anything, we're looking to figure out how to put more buses out there, but social distancing is now 15 or fewer people on the bus, and you must wear your cloth mask when you get on the bus. I also want to let everybody know that also starting today, RIPTA drivers are going to be assisting us with Meals on Wheels. We have had a huge increase in demand for Meals on Wheels. I think it's up about 4 or 5 times what it typically is. So we're delivering thousands and thousands of meals to seniors in their homes. Obviously, that's been a challenge, so thank you to RIPTA for stepping up on that. And if you're one of the folks who's waiting for a meal, Meals on Wheels, you should know that RIPTA is stepping up, and that means we're going to have greater capacity and be able to deliver more meals to seniors in your homes. So that was a lot of information, and I will now turn it over to Dr. Alcott.
Thank you, Governor. Good afternoon. I also want to recognize Holy Week. This is an important time for many faith communities throughout Rhode Island and throughout the world. And faith is one of the types of foundations that we need to lean on to ground ourselves during unprecedented times such as this. So with that, I will get started with going through the numbers with our cases. We have 288 new cases today, which is reflective of the expanded testing that we have been successfully accomplishing. This brings our total to 2,015 cases. As the governor also shared, we sadly have 6 additional fatalities to report. We now have 49 COVID-19 associated fatalities total. One of the people who passed away was in their 60s. 4 of these people were in their 90s, and 1 of these people was in their hundreds. 5 of the 6 fatalities were associated with nursing home residents. I've reported out about a number of very unfortunate fatalities over the last few weeks that are associated with nursing homes. Nursing homes throughout Rhode Island are working very hard to prevent cases in their facilities, as well as to prevent the spread of illness in their facilities, and to keep their residents and their staff members safe. At the state level, we are working directly with nursing homes to get them the support they need. And we're working with Rhode Island Responds to support the nursing homes with the staffing that's needed. People in nursing homes are some of our most physically and medically fragile Rhode Islanders. Nursing home staff and administrators in Rhode Island are enormously dedicated to the residents in their communities. The challenges facing them and the challenges facing us as a state are that this virus is very transmissible, and it is very serious for older adults and people with underlying medical conditions. The best way that you as an individual can help keep older adults and all your fellow Rhode Islanders safe is by following the directives we are talking about every day. Stay home if you're sick. Do social distancing. Wear a cloth face covering when in public. And call your healthcare provider or go to cvs.com if you have symptoms so that you can get tested. When people are out crowding in places, when people are not staying home if they are ill or staying home the way they're supposed to, those people are being enormously selfish. They're putting their lives of other people at risk. We need everyone to follow the guidance that the governor and I are giving. This guidance can save lives. I want to address one last issue. If you Google PPE litter, in a matter of seconds, you'll see links to hundreds of articles and TV stories about this problem, littering of personal protective equipment. But just because it's happening everywhere does not mean it should happen here in Rhode Island. The governor, Director Janet Coit of the Department of Environmental Management, and I are asking Rhode Islanders to take an extra minute or two and throw away your used PPE, such as masks and gloves. Throw it in the trash where it belongs. Don't just throw it into a parking lot or onto the street where it becomes ugly, unsanitary litter and someone else's problem to clean up. Another issue is wipes and disposing of wipes. Please do not flush wipes down the toilet, no matter what the container says is okay for it to happen. The clogs caused by wipes damage critical wastewater treatment infrastructure for our state, and we do not need that to happen. They can cause a further health hazard by backing up sewage and sometimes sending that into buildings. We've been asking for several weeks now to people so that you can do your part. This is just one way that you can contribute to making Rhode Island the place that we want it to be. Safe for all and clean as well. I'm going to pass it back on to the governor for questions.
Actually, Doctor, if you'll handle the first question.
Yeah.
From Anita Buffoni at WPRI, how many positive cases of COVID-19 are from people living in group homes? If there is a surge of cases at Rhode Island group homes, like in other states, how does the Department of Health plan on responding?
We have a very active process with addressing the number of cases in group homes. Group homes are one of the types of congregate settings that we are responding to. We've spoken most about nursing homes because that's where most of our cases are connected to, but we do have a number of cases associated with group homes. With all congregate settings, there are about 14 outbreaks in long-term care settings, which we refer to as nursing homes, and 10 in non-long-term settings, which would be the group homes. We have 387 positive cases where there are nursing homes in a congregate setting and 123 cases in the non-nursing home settings, such as group homes that are congregate settings.
Thank you. And Governor, the next question is from Bill Bartholomew. I'm getting a lot of questions about crossing state lines, whether for groceries, boating, or other non-work-related activities. If a person crosses into Connecticut or Massachusetts, even for a moment, are they required to self-quarantine? Further, may Rhode Island businesses prohibit out-of-state travel? I imagine the rest of the question says for their employees.
So those are two different questions. The answer to the first question is yes. You should be staying home right now. There's a stay-at-home order in effect. You should be staying home. If you leave the state and then you come back, you are quarantined. Absolutely yes, without question. Now, as I have said, some people have to go to work. So if you have to drive across state lines to work, then that's different. Obviously, you go to work, but when you come home at night, you have to stay in your house. So I know this, I'm very happy you asked this question because, frankly, I'm really quite worried about this weekend that's coming up. It's a holiday weekend. The traffic was up a little bit this morning versus other mornings this week. The weather's supposed to be nice. This is the absolute critical time right now. You don't see Rhode Island flying up the curve and having our hospitals overfilled. That's because you guys are doing a great job. I got some data yesterday which suggests that our social distancing is really having an excellent impact, and also that we are doing a better job as a state complying to and heeding the directions. Now is not the time to ease up. When we can ease up safely, I'll be the first to tell you we can. Stay at home. The stay-at-home order is in full force and effect, and that includes for this weekend, which is a holiday weekend, and for anything. Secondly, the thing about work, again, that's different. That's for work. So some people do have to cross state lines to do their essential work, and I've already answered that. By the way, you should be working from home. If you have to work, you should be working from home. You shouldn't be going into the office. If you're a lawyer and you're going into the office on a regular basis, you're doing something wrong. You should be working from home, or an accountant or anybody. If you must go into work, you go to work. If you cross state lines, you go home and you stay in your house. That is the way we have to live for now until May 8th, because in my judgment, that's the only way I can keep everybody safe.
Thank you, Governor. Dr. Alexander Scott, the FDA authorized emergency use of hydroxychloroquine for severely ill coronavirus patients who are already in the hospital. Have any Rhode Islanders received treatment using this drug in combination with azithromycin, and if so, how many and what were the results?
There are a handful of compassionate use treatment modalities that are possible. We are working closely with our infectious disease provider community to support them in determining which treatment option may work best for which patient. So I can get back to you on the number of patients that may have been offered the hydroxychloroquine option, but it's important to know it is in specific situations that our infectious disease providers are aware of and are determining for the patients to qualify, knowing who is most at need versus who isn't. It is not a medication that anyone should just go and acquire from the pharmacy or have written from their primary care provider to be able to just take. It should be used for the specific situations that it has been emergency use authorized for.
And that question was from Alan Gabberty. The next question is from Christy Nadalin of the East Bay Media Group. Reports suggest unexpectedly high compliance with social distancing mandates have improved a number of models of duration and severity of this crisis on a national level. How has local compliance affected Rhode Island models, for better or for worse?
So, good news on this one. About a week ago, I had said that we weren't doing a good enough job here in Rhode Island heeding the directions around social distancing. And people were still traveling too much, our mobility was too high, crowds in grocery stores, crowds in big box retailers. As of yesterday, when I went through the data, we're doing a much better job. So thank you, and keep it up. Do not let up. Do not go shopping this weekend. Do not go out with your friends. Do not have a big Easter gathering this weekend. I don't want to see crowds anywhere. Don't go to the park in crowds. Like, this is the moment. I need you to be very serious and stay at home. No, and I know it's hard. It's hard for me and my family too. The good news is you can see it reflected in the data. You know, about a week or so ago, we were doubling our hospitalizations every 4 days. It's not quite that fast. It does not mean we're out of the woods. We're still ramping up to the curve. We haven't hit our surge. But it is clear that what you're doing is working. It's keeping you safer. It's keeping Rhode Islanders safer. And quite frankly, it's making it so that I can really start to think about reopening this economy sooner rather than later. So good job, but keep it up, because now is a critical time.
Alexander Leslie of WPRI Channel 12 asks, are there any local companies developing CPAP machines or ventilators? If so, which companies and which devices?
The answer is yes. Neither of us at this second can recall the names of the companies. I know there's a company in Cumberland who's helping us. I'll have to get back to you. The answer is yes. Dozens of companies have reached out, and dozens of manufacturers have reached out. I'll get you a clearer answer.
Kim Kalunian from WPRI is asking, are you considering an executive order mandating that customers and essential workers wear masks when visiting or working in places like restaurants, pharmacies, and stores?
I am considering it. I'll say a few things about that. What I am doing is working especially hard with my team to procure more masks. So let me tell you where I'd like to be. I would like to be at a place where I could just distribute surgical masks to whoever needs them, particularly essential employees and critical infrastructure workers. Sadly, we're not at that place. We're getting closer, but to give you a sense, that's where I want to go with this. I would love to be there, you know, in a week. That would make it easier to absolutely mandate it if I could, in fact, provide the supplies. In the meantime, I will say there's been pretty good compliance with the order, with the direction, which lets me think we don't have to do an order. The other thing, truthfully, is we don't want people to think that wearing a mask is a panacea. So in consultation with the Department of Health, we're comfortable where we are right now. We're asking everybody to do it. When I drive around, I want to see everybody wearing a cloth mask. We're asking everyone to do it. Most people are. Asking you to get creative, but really want to emphasize it is not a substitute for social distancing, staying at home, washing your hands constantly, using Purell constantly, and absolutely 100% staying home if you are sick, period. I don't care what you do for a living.
NBC 10 asks a very similar question, asking why there has not been a mandatory order for these same workers, but goes so far to ask about the people that are working in drive-through food restaurants.
Yeah, so again, I am asking all of employers to do your very best to require your employees. Certainly if you're in a customer service business, like a drive-through, you should be requiring your employees to wear a cloth mask, absolutely. And I would ask you to try to procure surgical masks for your employees. At this point, for all the reasons I just said, we're going to keep it as not as an order. Doesn't mean that won't change. And we're working overtime to get more masks and gloves so that we can distribute it throughout Rhode Island to employers and essential employees who are still having to work.
Gina Marini of WPRI News asks, what is the protocol with testing employees and staff who don't show symptoms at nursing homes, assisted living facilities? If someone are asymptomatic, why isn't testing across the board happening to prevent more spread? If isolation protocols are in place and followed, and this is where the question does get cut off, Gina, can you explain the protocols for those?
So I've shared on occasion that we have very aggressive measures that we're taking in nursing homes to be able to curb the spread. I've given some examples. What you've asked about, Gina, is another example of what we're doing in very targeted situations where we are assessing, because of the congregate setting, there are aggressive steps that we can take to understand the landscape, both of the staff who were there as well as the residents, by doing testing. But the key is for us to be able to really monitor that, because it's important for people to continue to hear the test works most accurately on people who have symptoms. So when we are doing it in targeted situations such as congregate settings where we are using the tests on persons who may not have symptoms, we're doing it for very specific reasons to help understand what's the best way to take the most aggressive infection control measures we can within those specific congregate settings, and we're helping to make sure that people are interpreting those tests appropriately. In those situations, when there is a negative test result, that's not something we can rely on in terms of saying that a resident or even a staff person no longer has risk of exposure. Because of that specific setting, we have to apply very nuanced and targeted interpretations to the testing results in terms of how we have an aggressive infection control response. I've shared other examples of what we're doing, and so that question allowed me to share a little bit more about that as an additional example of what we're doing in nursing home and congregate settings.
The next question is from Tanya Signori of the Rhode Island Echo. The numbers for both people currently in the hospital and number of people that tested positive is a cumulative number. Considering some individuals have been discharged, what is the current number of hospitalizations?
The current number of hospitalizations, which evolves each day, is 169.
And again, Tanya, your question gets cut off, so I'm sorry that we're not answering the second part of that. Governor, the next question is for you from Nancy Thomas of Rhode Island News Today. You did not mention the unemployment extension benefits of 4 months for people who have recently run out of unemployment. The Rhode Island Department of Labor and Training workers say they do not know how to process these claims as there is no process to do so. Meanwhile, Director Jansen is saying it's all set, in quotes, in media interviews. Can you respond?
I'll look into it and get back to you. As I said on Monday, DLT will be putting out clearer guidelines for all of these categories. So if you can just hang on for a couple more days, I hope that we'll be able to clarify this. I will just remind you that we're trying to process 132,000 claims additional under our typical UI benefit structure, as well as brand new classes of benefits that the federal government has just sent us regulations for and is constantly updating the regulations for them. So that's my problem, not your problem, and we're figuring it out. But just bottom line is apply and give us a few days and we'll try to clarify it, and we'll do our very best to get checks out between 7 and 14 days.
The next question is for Director Smiley from John DePietro. What can you tell us about the testing process of the 20 core members of the executive branch who tested positive? Will all members of the executive branch be tested? Also, will the public learn if an elected state official, such as the Speaker or Senate President, tests positive?
So last night it was reported, and we've been reporting regularly on the status of state employees. So of the approximate 8,000 people in the executive branch, and what that means to us is everyone who's under the governor's employ. So that's everything but the judiciary, the other general officers, or the legislature. So of those 8,000 or so employees, we have, as of yesterday, 20 positive employees. We've been communicating regularly with our staff, not just about the protective measures we've been taking, but also about what's coming next. We've been talking a lot about an upcoming surge, and so we've been trying to communicate extra with our staffs because we know that they're concerned, and as the governor has mentioned many times, these are essential staff that do have to come to work. They're answering your DLT calls and answering the hotline at the Department of Health and other critical functions, now more important than ever. And so we have a rigorous protocol in place for all employees. We've worked closely with our partners in organized labor, all of our employees' unions, to make sure that they know what to do if they're experiencing symptoms. For about a week or two now, we've been screening all staff before they come to work. There's National Guard or sheriffs at every state facility asking a series of health screening questions as derived by the Department of Health to make sure that those who do come to work and might be exhibiting symptoms are turned away at the door, and then they're facilitated with a timely test. There's a protocol put in place for what to do with your immediate work space and who else needs to be quarantined until those test results are released. And we've done so in a way that has hopefully reduced tensions and made our staff feel like we are truly looking out for them and doing everything we can to keep them safe and productive at a time when they are in fact essential. We have not been testing anyone who's asymptomatic, just like the rest of Rhode Island, and we don't intend to do so until the Department of Health gives new protocols for all Rhode Islanders.
If you could, the second part of the question asks if the public would be made aware if an elected official were tested positive.
I can't speak on behalf of other elected officials on what they may choose to disclose about their public health information.
Thank you very much. The last question today for this Friday briefing is from Ellie Romano of ABC6. Bradley Hospital is reporting several patients and staff at 2 of its group homes had tested positive for coronavirus. This is another example of a congregate living situation. How is the Department of Health making sure the virus does not spread like at nursing homes?
With every congregate living situation, as you described, we are taking very aggressive infection control protocols. It allows me to highlight that, as I said earlier, nursing homes are implementing that. It is just the challenge of such a medically and physically fragile community that exists in our nursing homes with such a transmissible virus makes it so that we have seen the unfortunate numbers of cases that we have seen. But the same aggressive approaches to stop that type of spread is occurring in our nursing homes, as well as our group homes, as well as in homeless shelters, any congregate settings that we have. And in some of those other settings, there may be residents who are not as medically or physically fragile as those who are in nursing homes and may be able to have different outcomes. But our effort is going to be the same, and our focus on these priority groups is the same across the board, with a particular heart for our nursing home and group home and homeless shelter settings. So thank you.
Thank you, Doctor. Thank you both.